You're listening to Ask Dr. Jake. I'm Dr. Jake Tucker, owner and founder of Good Life Family Chiropractic here on the south side of Lincoln. And we're coming to you today with another message of hope, health, and wholeness. And that's what I want for each and every one of you. I want you to have hope, no matter how bad your health is, no matter how deep in medical debt you feel like you are. I want you to have health. God created us for health. That's our default state. But when we interfere with the healing process, we start to lose our health. When we go against those laws and principles that He designed that create health, we start to suffer the ramifications, or as I tell my children, the consequences of sickness and disease. And ultimately, wholeness. It's all about wholeness. Health is a state of 100% optimal function and healing. And that comes from living in every single aspect, completely whole, the way God designed us. And so that, we see that in our office all the time. I had a patient come through, and she didn't come to me for this. In fact, she forgot to even mention it on her intake questionnaire, but she has really bad seasonal allergies. And with all the smoke in the air, we're seeing a lot of people coming through the office saying that their allergies are flaring up. That's become a really awful problem. But this gal, she works in massage therapy. She's a little bit more holistic minded. She's been doing natural treatments for her allergies for years to varying levels of success. But I sat down with Abby just today. We did her adjustment. And she said, Dr. Jake, I don't know if this has anything to do with anything, but this is the first year where allergy season is kicked up and my allergies are better. And I just said, well, awesome. Yes, absolutely. It has to do with things. And I get this every single year. Yeah, we'll get patients in that started before allergy season. And then all of a sudden their allergies during allergy season go away and they're never as bad as they were again while they're under our care. And I said, this is absolutely tied in. And I showed her on the spine and on the nervous system chart where the nerves go out that control the immune system in particular. Allergies, when you have allergies, it's a sign of an autoimmune dysregulation. So basically your immune system is not properly responding. You think of something like pollen. You drown yourself in pollen. You drown me in pollen. And I don't even have allergies. If you were to drown me in pollen, my immune system would try to kick that back out. I would get snuffly. I would have coughs. My mucus production would kick up and I would sneeze all the time. If I get too much, but give just a little bit to somebody who has an autoimmune dysregulation, like what we call quote unquote allergies, and now they get those problems. And some people have really severe allergies, and it's a really severe autoimmune disorder. And oftentimes those people with the worst allergies also have asthma. And it's the same thing. These are problems in the proper regulation of the immune system. Well, what controls that regulation? What regulates your immune system? It's the nervous system, the central nervous system, specifically the area right under the base of the skull, exiting off of the brainstem, sends nerves out to the mucous membranes in the mouth, nose, and throat, out to the lungs, out to every cell, tissue, and organ in your body, and controls the immune response there. If that's not properly regulated, you will have a greater likelihood of having asthma-like problems, whether it's induced by exercise or induced by the outdoors, or it's seasonal and you start dealing with it when you have ragweed start sprouting up, or you have golden thistle, or whatever it is that's creating your allergies. It could even be food allergies that are kicking this thing up. And so if you're dealing with those and you've never had your spine evaluated, then mention it. Mention it when you call 531-289-7100. Mention that you're having allergies and that Dr. Jake talked about just the role of the immune system. And what we're going to do for you today, just like we do every day, is the first 5 callers today are getting a 50% discount off of an exam, any necessary x-rays, consultation, report of findings, and get that for all just $65. If we do the first adjustment on the same day, that'll also be a 50% discount. So you're getting over a $200 value for just $95. And so don't hesitate. Call now, 531-289-7100. But that's not all I'm seeing. My goodness, it's been crazy this last week. We've had so many people hurting themselves while they're working out. We had 2 just this morning, came in literally right after they were working out. And it's such a common issue. When we have a bad back, it doesn't always hurt. But when we do physical fitness, which is great for us, I recommend everyone exercise. It's one of our 5 essentials. But if you do it on a bad back and you do it in a way that doesn't help the back to get stronger per se, and I'm not talking strength as in force. I'm not talking about the ability of you to lift more, but actually build up the integrity of the spine, right? If your core is weak, it doesn't matter how much muscle you have on top of it, that foundation is crumbling. And so many people have bad spines that have a strong back when it comes to traditional strength, the way we measure it, being able to squat 300, 400, 500 pounds, and the vertebra and the joints underneath are crumbling with degenerative arthritis, or they've got a scoliosis. And every time they do it, it just makes it more likely that they're going to be susceptible to damaging it. The talk about, a herniated disc. Now, it's not just my weightlifters. It's not just people that hit the gym. But if you have a scoliosis, if you've got a spondylolisthesis and you're working out on that, whether it's walking or running or biking, you're increasing your risk of herniating that disc, of creating a bulging disc, or having part of that disc tear off and just float around your spinal cord and create issues that just kind of float, that travel up and down, and it doesn't seem to match any pattern. Well, it's because there's been damage to the disc in there. It's because the nervous system isn't properly regulating and healing the way that God designed it to. So one of our gentlemen, one of our patients this morning came in. He actually made this appointment because he was doing a new workout. And he said that immediately following this movement, he could tell his posture just was not right. He was doing too much weight and not having good posture through it. He was pushing himself too hard. And he said that almost immediately his back flared up on the left side, and he started to feel it down his leg a little bit. And so I looked at it. His pelvis was completely off. The SI joint, the sacroiliac joint, the joint in the low back next to the hip, had been locked up because of the way that he was holding himself. And it was all due to his posture, the way that his spine was aligned. He already had a spondylolisthesis in his low back. So I was able to sit down with him and talk to him about it. And yeah, he knew that his posture was bad. But this is someone who's also lost the urgency with the care for his spine, where I've recommended he come once a week. He's coming in maybe once every other week to take care of his spine. And it's like, no, we just have to reinforce that spinal care is just as important, actually more important than oral care. You can live without your teeth. You can't go a single second without proper nerve supply. And so we worked with him on that. We got him off the table. I said, take a hot bath, put ice on this. Definitely don't do direct heat on a bad disc if we're dealing with a bad disc, but a general bath won't be an issue here. Epsom salts are great, maybe a little lavender to calm things down. And he did awesome. He did great after the adjustment. Now, we did have to do a second adjustment right after the first to clear out some of the layers of subluxation in his spine, but he responded beautifully to that. And if you're dealing with back pain following an injury or a workout, then absolutely pick up the phone and call our office, 531-289-7100. And what we specialize in here isn't just pain relief. I'm not just looking to get you feeling better. As much as I want that, my goal is to get you feeling better by getting you healing better first. If you heal better, if you function better, if your overall function is performing at a higher level, you're going to do just so much better. And we do that through advanced structural correction. And so if you have a scoliosis in your low back, if you have a scoliosis between your shoulders, we don't have to leave that there. It's like saying, well, we want to get you healthier, but we're just going to leave that type 2 diabetes alone for now and just deal with your heart. You can't do that. You can't separate the two. You can have heart disease and diabetes, but you can't treat them separately and expect to get healthier. You have to make the whole self whole and healthy before you can start to deal with the thing. That's why this whole system of dealing with symptoms, symptom management, disease management is so off the rocker. It doesn't work. And actually, that's what this masterclass we're doing on Saturday is all about. If you've been listening for a while and you know that you need to take it to the next level and get healthier, that you're seeing your chiropractor, you're doing the nutrition thing, you're doing the fitness thing, but you just need to take it to the next level, then you won't want to miss this Saturday. It's a free class, but I'm asking for a 6-week commitment. We're starting off with the introductory class on Saturday, and then the following Saturday, we'll dive deep into viruses. Virology is what we called it in school. You'll get to study from a holistic perspective how to get a healthy nervous system, how to get a healthy immune system so that you can better fight off viruses, bacteria, cancer, and get yourself to a place where you're not sick and tired of being sick and tired anymore. And I get so many people that call me and just tell me how tired they are of being sick and tired, that come in for an exam, that have been dealing with pain for years and years, chronic pain, chronic health issues that just don't have any answers. And if you're looking for an answer today, pick up the phone and call our office, 531-289-7100. And remember, first 5 callers today get a 50% discount off of exam and any necessary x-rays. And so don't hesitate, pick up that phone call today and set an appointment for this week. And we'll give you that 50% discount for everything that we do on that first day, on that first visit. So yeah, it's been another interesting week. You know, it wasn't just Ronaldo that came through with the bad back after working out wrong. We actually had another patient that's been under wellness chiropractic care and done awesome for the last 3 years. But she came in this morning after her workout, just immediately. She could tell she did something. She was doing a deep lunge with her leg raised up behind her, and just something went. She thought, oh, I must have slipped a disc. And now, for those of you that are listening, there's no such thing as a slip disc. The disc is either there or it's bulging and it's herniated. The disc doesn't slip out of place. What happens is that disc is made up of tough outer fiber, and inside it's mostly liquid. And that liquid can sometimes start bulging out the back. And especially as you tear through those outer fibers, that harder outer shell of the disc, as those start to tear because of wear and tear, then ultimately the liquid material inside starts to slip out. Now it can bulge without it slipping out, and that's a bulging disc. But if it ever slips out from between the fibers, now you've got a herniated disc. And then if that ever tears off, now you've got a ruptured disc. And that's ultimately the worst possible case, because once that's out, now you have to have surgery in order to get that out, or just live with the ramifications, constant pain, digestive distress, just name it, all the things that can happen when you rupture a disc. Most people opt for surgery when they have a bulging disc, but that's the problem. When the disc is just bulging, we can still correct that by addressing the cause, by addressing the biomechanics. And you know, she did not actually slip a disc. All she did is she irritated the sacroiliac joint in the pelvis. We were able to address it right away. I gave her the same recommendations: hot bath, Epsom salts, lavender oil, just to calm the muscles down around it. And ultimately told her, come back a couple times this next week, and we're going to work you out of this, because ultimately her spine is healthy, except for that she put herself in a compromising position that aggravated things too much. If you've done that this week, pick up the phone and call my office, 531-289-7100. We'll get you back on the path to health and wellness and vitality every single weekday here at 9:30 a.m., 10:15 p.m. on KCRO. I'm Dr. Jake. Join me again tomorrow for another episode.